Well, one of the other stories that our colleagues have been working on across the BBC today is about health, and it's about how long it is taking people to go from accident emergency onto a ward if they need a hospital bed. And the BBC found through lots of research that more than 40% of people are having to wait more than 4 hours for that process, which is breaching the government target. So that's been a big story today. And we thought that would give us an opportunity to just talk about life in hospital at the moment. And we're joined now by Dr Salwa Malik, who's in Brighton, and she's Vice President at the Royal College of Emergency Medicine. She's also a consultant in the emergency department. Hello, Dr Malik.
Hello, thank you for having me.
Thanks for coming on. Bluntly, it doesn't sound like a great time to get ill at the moment.
Unfortunately, it's been like this in the emergency department for a very, very, very long time. We're certainly seeing the winter starting to kick off, and so there is a lot more illness around. But unfortunately, the state of emergency departments has been like this for years now, and we have been calling for more support through staffing, through more beds, more social care. Unfortunately, we've not actually seen any results, so that is why the state is as it is, as you've just declared. It's no longer really 4 hours. Patients are waiting well over 12 hours, well over a day within an emergency department, and that's unacceptable.
On the radio this morning, the Health Secretary was saying that there's several new medical schools are about to come on stream that were commissioned by Theresa May a few years ago, so they're ready to go now. In the autumn statement, one of the surprises in the autumn statement from the Chancellor was billions of extra pounds for the NHS over the next 2 years, which people weren't expecting. And also Boris Johnson's signature pledge was tens of thousands of extra nurses.
You're making it sound like all of our dreams have been made true. It's not amounted to anything, has it? Because if it did, you wouldn't be seeing the problem you did today. Yes, there were plans for medical schools. It takes a long time to train a medical student to become a doctor, and then they've got to go through the training. It's not as simple as that. We need senior decision makers, and it takes years to get that on board.
And into this dire situation that you paint, we then have these strikes coming up where plenty of your colleagues are going to be walking out and, well, seemingly making a bad situation worse from a patient's point of view.
Well, I have to say that the Royal College is not a union, so we can't really comment on terms and conditions. But what I can say is that imagine how bad things have got to be in order for a nurse or a paramedic to strike. That's got to be pretty bad, because these guys don't strike. These guys are so committed to patient care and to keeping their patients safe. They're dedicated and they're hardworking. But right now, we recognise that they are overstretched. There are fewer of them than there were before. And so therefore, they're getting burnt out very quickly. And we're really worried about retaining this staff. They are leaving more than they're joining, and that is a real problem.
I'm just wondering, I mean, we're about to get into proper Christmas party season, and we all know from the documentaries about accident and emergencies that that's a really busy time for you, with people getting really drunk and really injured. Could that be the thing that actually just tips the system over the edge?
No. No,
okay.
You've totally missed it. That's not it at all.
Well, no, I'm just thinking because it sounds like we're at. It sounds like we're at. Well, no, I just mean it sounds like we're at a tipping point where actually the whole system is teetering, and I just wonder what could be the straw that breaks the camel's back.
I don't think that will. Actually, I think what breaks the camel's back will be deaths. And unfortunately, we already have evidence to show that if patients are waiting for more than 8 to 12 hours in an emergency department, their mortality rate goes up within 30 days. And we already have that evidence. We've had that evidence, and we've showed that to the government since earlier this year. It doesn't seem to have touched anyone. That's my worry. Okay. If that gets worse, that's going to break us.
And I mean, I talked about those documentaries about seeing a fly on the wall in the department, but could you just sort of paint us a picture about what will it be like in your emergency department tonight on Thursday night? What does it feel like? What does it sound like? What are people's kind of emotions and stress levels like?
So I think scared is one picture. I know we've had frail patients who have been shaking, literally trembling. And you've gone over and asked them, you know, are you okay? And they've responded, I'm frightened. And the reason why this particular lady was frightened was because she was in a corridor full of patients. There are departments around the country who can hold up to 38 patient trolleys in their corridor. How do I know that? Because it's happened. And if you could just close your eyes and picture this, trolleys in front of trolleys, and then imagine the person in the back trolley having a cardiac arrest or becoming unwell, and the doctors and nurses needing to get to the emergency. How are they going to get to them? They have to pull other trolleys out of the way in order to get to them. It is utter chaos, but there is just no space to lie these patients, and that is why now trusts are having to hold ambulances, because it's not safe to keep them in crowded departments, and that is having a significant impact on the ambulance trusts now, who aren't able to get back out into the community. It's a terrible knock-on effect. But if you can imagine working in an office, you've got space, you've got light, natural light, you've got refreshment, you've got things that you need, and then imagine my working day, which is utter chaos. It is like people everywhere, lying on trolleys, sitting on the floor, standing in the corner. There is no call bell for people in the corridor to, call for patient help. You're relying on our nurses to literally pick up on these signals. And they can pick up on these signals, and they continue to pick up on the signals. But it is not safe to leave things like that. And we are at a point where we cannot stress enough. We really do need more money injected into social care immediately to try and alleviate the pressure of the hospitals.
I mean, you paint such a vivid picture there of what it must be like. But the thing that leapt out to me at a sort of like on a brain level rather than an emotional level is all the hospitals calculating how much space there is in the corridors, because the corridors have become an integral part of the hospital, not just the way you get from emergency to ward or ward to ward. It's like actually it's become part of the treatment space.
Yes, it shouldn't be, right? It shouldn't be a clinical space. It's not a clinical space. There's no sinks there. You can't get refreshments. There's, like I said, there's no call bell. There's certainly no privacy. There's no dignity. There's no confidentiality, which is terrible as clinicians and for nurses and HCAs, porters who work in that environment. It's very difficult. We didn't really sign up for that, but we have to do whatever we can do to keep our patients safe. And so that's why things like the 4-hour standard at the moment don't mean anything. We are just trying to keep our patients safe. That's what I tell my juniors every day, is just keep the patient safe and just make sure that you're okay as well and that the staff are well supported. That's all we can do right now.
Dr. Malik, thank you very much, and good luck coping with this very difficult situation over the next couple of months.
Thank you very much. Thank you for having me.